welcome back to the morning show. I am Marshall Shore.
And I'm Melissa Farley. We're here at the
fabulous
fabulous 726 Studios in the
heart
heart
of
of
Roosevelt.
All right. Thank
There
you,
you-
Yosemite Sam. I like it.
Indeed.
All right. We have our first guest of the morning here, Dr. Carla Freeman. How are you?
Good. Thank you so much for having me here in the heart of Roosevelt. That's so fun.
Thank you.
Indeed.
I love the
Yes.
blue. That is a gorgeous color on you.
Thank you. Thank
Yeah.
you.
Okay.
Those are their glasses.
I know. Wait, can we switch? Wait, I need those glasses.
Oh, yeah, those match. Go
Repping the
with
brand,
perfect.
Marshall. Thank you.
I'm not the cool one today. I don't have any glasses. Okay, so Dr. Carla, tell us a little bit about who you are, what you do about your practice.
Yeah, so I'm trained as a chiropractor, but I got into chiropractic a little bit differently. I started out as a patient. I had been in an accident when I was very small. I got hit by a car like I was 3 or 4 years old, and I just lived life. And by the time I was in my 20s, everything was normal. That meant I had a headache every day. My back hurt. Everything hurt. I didn't really know it hurt, but it just was like a typical thing of I couldn't really work out. I couldn't do things other people could do. Growing up as a kid, I run a little bit. I couldn't breathe. Like, I don't know. It was just like I was always heavy. I was always overweight. So it was like, and it mostly got blamed on my weight, right? Oh, you eat too much. You're heavy, And then later in my 20s, I was in a gym one day and a lady was doing something at a table. I don't even know. I know now they call it a screening. And she literally just had like a mirror and a string, and she held the string up to my pelvis at my waist. And she said, you see this string? It's when I hold it up to your waist, a normal pelvis should be level. When I hold it up to yours, it goes like this. You should come see my chiropractor. And so I did. I'd heard of chiropractic. I knew a little bit about it. I didn't really know what it was. And I went to see this gentleman, which I don't think, maybe he's here in Arizona now. If you were my chiropractor in 1998, know how great you did for my life, because I don't remember his name.
Yeah.
But I went a few times, but it is like a line in the sand. After I had that first adjustment, my life was totally different. And then, from there, though, I went on and I had children, and I got chiropractic adjustments all through my pregnancy. And then after I had the baby, I'm going to get back in shape. I was never in shape, but you think you're going to get back in shape. And all of a sudden I couldn't, I laid down on the floor to do like a Pilates class. I couldn't get up because it really changed everything. And all those things I've been putting up with, obviously with pregnancy, and the more stressful life gets, the harder it is for your body to compensate like I'd been doing the whole time. So I started going to a local chiropractor and worked with them for about 18 months and just changed my life, but also made me very excited to do things I could never do before. I felt like I want to eat better. What should I eat? And I want to, and how should I do this? And what should I do? And, now I understand as a chiropractor, you have a limited amount of time. There's only so much you can do for somebody. And so I just felt like there wasn't enough. So through my friends in my community, I met a practitioner who was doing this weird technique in her house. I didn't know what it was. People would just say, oh, it's kind of cool. It's this energy thing,
Yeah.
And this was the internet was still a baby at this point.
Okay.
This was 2001, so long ago. So there wasn't a lot out there about energy work and how your body works and things. And so it really was I don't know, this lady pushed on your arm and she asked you a few questions and had you breathe a certain way, and all of a sudden things just released and you just felt better. I don't know. I was like, is this what exorcism was? Because I was like, am I having the demons, exorcised out of me? Is this what that is? And, but it was just a profound shift in how my body was connected to itself, how I was, just how it did things. And again, it took a couple years. I would say I just dropped my body off on her table, let her do her thing. But I started getting interested in what was this. And it was a technique that had been developed by a chiropractor it was BEST for short. It's bioenergetic synchronization technique. But really, he had just studied neurology and how the emotions affect the body. Because as a chiropractor and a scientist, if something works, it should work a high percentage of the time, close to 100%, right? If it's true validated, we should get a repeatable, reproducible result.
Yeah.
And yet as a chiropractor, seeing many, many patients for his time, because in the 70s, chiropractic was kind of underground, he just said, why isn't it 100%? Why am I not getting more people? Why are there this 15, 20% of people that no matter what I do, they're not moving? And then he started studying, was it something they were eating? Was it a super, and then they started finding like, oh, they'd had some big stressful event, maybe around the time they were injured or maybe since they've been injured. And maybe that had something to do with it. And he started studying and he basically came up with a whole system of how to retime the nervous system, how to get the brain, I call it getting the brain reconnected to the body. So the brain's paying attention to right now, not still reacting to some old stress or trauma. So that kind of set me on the path. I wanted to learn everything about it. And I realized that I couldn't learn everything there was to learn about it unless I went to a professional program, and I got a chiropractic degree.
Okay.
And that helped me understand that this woo-woo energy thing that my friends had told me to go to this lady's dining room, to do actually was really based in neurology, physiology, like the science of everything we know about how the body works. And who knows, at this point, we might not even know 50% or 60% of really how this body works, because such a dynamic, amazing way that we're kept alive. But to find this kind of window into the system and be able to help someone get out of a pain cycle or get out of a stress or fatigue cycle and have their body start to function differently so they could heal like I did was just amazing to me. So
I think it's interesting you bring that up. I'm going to sound like I don't know what I'm talking about, and I don't. But I had flagged this New York Times article that I didn't have time to fully read, but it was like they had just discovered like a third system that the body uses, like the lymphatic system and the other. See, this is why I don't know what I'm talking about. The other one,
fascia,
the other main one.
maybe it was all about fascia. That's very hot right now.
But it was like all of the Eastern medicine practitioners were like, yeah, like this is what this is what we've been working with for all these
for centuries,
years.
and you just discovered it.
Yeah, and they're like, no, but like now that we've like discovered it, we can now study it to understand the science of why it works. Like, because back in the day it was like, yeah, this thing does something, but we don't actually know why or what, And I just think that's interesting because as somebody who does a lot of woo-woo stuff myself, it's like, yeah, like,
I know it works. Like, do we have to know why
Say
for it to work?
the name of the method, though, again?
So, bioenergetic synchronization technique, or BEST, is one of the techniques. And then I went to chiropractic college, and that sort of opened the door, and I found out there's all kinds of techniques. There's probably over 300 different techniques that different practitioners over the 100 years of chiropractic had taken their knowledge, what they learned as a chiropractor, what they learned, and look, if you open any physiology textbook, the first thing in the first page of any physiology textbook says our physiology is impacted by our emotions, but that's it. It stops there because in the science and medical world, there's not a lot of things that put those together. Although if you talk to the mental health professionals now, many mental health professionals are getting some sort of somatic training because they realize that like the talking alone doesn't necessarily change the pattern, and so now that's starting to be more recognized as we're studying things and as they're able to see more things on imaging. And I'm glad you referenced that article because I tell people that all the time, like, oh yeah, they can see the meridians on imaging now.
Yeah.
And when I went to physiology class, because I never had analogy, I was a business major, so I didn't know anything about it. I had to go back and take all these classes to get in chiropractic college, but it was fascinating to learn in anatomy class that where all of your veins and arteries come together in these certain spots are also where like the major chakras are. So like there's a physical component, an energetic component. There's obviously something that makes us able to drive a car in Phoenix. That's like you have to have a lot of like you dodge things before you even know they're about to hit you, right? Like you have to have a lot of awareness and a lot of survival reactions to be able to navigate our very modern and very busy world. And so in my practice, that's what I'm doing is I'm using your body's reflexes along with this knowledge of how your system will work to protect you to find out what it's actually reacting to. Because if it thinks you're being chased by a bear, it's not going to stop to digest your meal. Right.
Well, I'm so intrigued by this because Marshall's heard me tell this all the time, so he's probably bored. So I have very bad chronic inflammation and chronic migraine. And so like this week, that's one of the reasons I've been struggling so much is I've been in a lot of pain. And my husband, right, who's very loving, but is like kind of a man about it. And it's like, well, what are you doing that caused it? And I'm like, I don't know, and I think it's one of those things that I'm aware enough to know that my nervous system is having a response to something, but I don't know what it was. I don't know how to reset it. I don't know how to calm it down. Apparently, just knowing it isn't enough for the brain to like get on board, you know. And we've talked a lot about. We had a therapist on that works with trauma, and we were talking about the body keeps the score, and we were talking about how a lot of people are now using like somatic and trauma informed yoga to do movement, you know, with that. So what I'm curious about with you is my mom goes to a chiropractor all the time, like once a week. I've gone with her, seen what her appointment looks like. What does an appointment with you look like? What is that experience?
Yeah, some of it's the same because at the heart of it, it really was chiropractic is it's a tool that can really it works on your nervous system. Everybody thinks of it as, oh, it cracks my bones and it helps me get a back pain and neck pain, and it does, but we're not just cracking the bones because it's fun to hear them crack, because it kind of is. When they're making a chiropractic adjustment, you're actually putting a force into the system that kind of supersedes all the other forces and has your body have to stop and go, whoa, what just happened? And it's because we're doing it in a precise way, and we're making that input in a way that's actually puts the body in a more efficient position. The brain goes, oh, you're right, that's better, let's do that, and then it reorganizes around it. However, again, if there is some other stress that the brain thinks is more important than that little push you just got from, you know, in the back of your neck, it's not going to really turn the needle. You know, you get the adjustment, you feel good. Sometimes it relieves a lot of stress and pain. Like I said, it did for me. It changed my life, you know.
Yeah.
And even after I had done all that work for a couple years with a chiropractor, I was still going back in the chiropractic model, which was like, oh, go see if you can go 6 weeks without needing an adjustment. And I was going back like, it's the same spot here and it's the same thing here. And why is that? Well, when I started working with the best practitioner, it's because my body had a certain way to deal with stress. By a certain age, you know, women of a certain age, which I am now, you know, you've just made a lot of patterns to get here. You've made a lot of patterns to survive. And when you're stressed, your body's going to default to those patterns, and they're not the most efficient patterns.
Okay.
So for someone that has a chronic issue, and that is, I work with a lot of women, and that's been my whole practice since I came to the Valley and after I graduated in 2015, is I've focused on women with these seemingly chronic and complicated issues that seem to come out of nowhere. You go from doctor to doctor to doctor, and they just tell you, oh, you're emotional, right? Like in women's health, this has been our thing, right? Like we've been called hysterical for years.
Yeah.
And we have a different body every week. We have hormones. Men, not so much. You know, you guys are pretty static, but we have a different hormone peaking and ebbing in our system every week. So our body is very different from week to week.
Right.
And there's a lot more that can go wrong if that system is interrupted. And when you're stressed, you produce more stress hormone, cortisol, adrenaline. And when your body makes the triggers to produce that stress reaction to protect you, and then it just thinks it needs to protect you and protect you and protect you, you're like never out of it. And so everything gets thrown off. So that's the thing, is that with in my office, you come in, we're going to do a full chiropractic exam. We're going to talk about what hurts and what's not moving, but it's also functional. And we're going to look at, is there an emotional component? Because with your body's reflexes, I can show you if it's emotional, physical, chemical, all the above. Now, it's, you know, it looks very woo-woo. I mean, I can even demonstrate if you want to. It looks like weird, like how do you know that? But it's the best guess you have. It's like a better guess than anything else, right? You want to see? All right.
What do we do?
I don't know. Camera guy, what should we do?
Can
if
we
you want to
do we need
stand
to stand?
up,
Okay.
is it okay if we stand?
She's going to demo. Yeah.
Yeah.
Okay.
So if you hold your arm out here,
Okay.
and if I push down on your arm, it's just nice and strong, right? I didn't even have to tell you, hold your arm up. You have a reflex that holds your arm up. Now if I come right here, now you've already got a lot of things right there, but if I come right here, do you see how that gets harder? Your arm's pretty bouncy.
Yeah.
You're like struggling to hold your arm up.
Yeah.
But then I come away. Now that was a reflex. It's the same reflex. It's a similar reflex to if I tapped your knee with a hammer.
Okay.
Right? Because if something is flying at you here, your body should be like defending itself, like, whoa, what's coming at me there? Because it's kind of vulnerable, right? Like, why is there something coming to the middle of my head?
Okay.
All right. So, but if you're doing normal things like turning your head or moving your eyes, I don't know, you should be able to hold your arm up and turn your head, right? You drove here, right?
Yeah.
Okay. Turn your head to the other side. So as soon as you do that, it goes bouncy. Turn your head back towards me. This is strong, so I don't know, in this direction it's fine, but turn your head that way. Okay, don't make any left turns today, Melissa, because otherwise Your body doesn't know where you are. Only right. Only right turns, okay?
Okay.
So it just, all that means though, is on a physical level, your body, as soon as you turned your head this way, the signal got a little staticky. I know, for us older folks, me and Marshall over here, I might have to say, remember when you have to turn the radio in, they're static and you can't hear?
Yeah.
The kids don't know what we're talking about. You know how it's like if you're trying to talk through a cell phone and there's like all this interference, how
Yes.
frustrating that is? If your brain is doing that all day long, trying to hear through static, where's your body? What do you need to do next? It just makes you more fatigued at the end of the day. It's going to use up your resources faster, right?
Yeah.
We can't do it for 2 minutes on a phone call. Think
Right.
about your brain. So if we clear that out physically and get that connected and your body knows exactly where your head is, where all your joints are, so it knows how to move you through space and keep you safe, that's why chiropractic is so powerful. It's because we get that connection clear so your brain doesn't have to work so hard just to navigate you through life. So that's step 1.
Interesting. Okay.
Now step 2
Yeah.
is to find out, well, why is it disconnected? Is it just physical? So put your hand on your forehead like this and then turn your head to that side. Nice and strong. So you're contacting your emotion points right now. Okay, so it's like it makes sense too. Right? Like, oh, Dios mío, like what's happening, right? Like we all do that if we're upset, like our mom, your mom, oh,
Yeah.
like right. So there's some emotion points here that are like again reflex points. Now when you're contacting those, you change the pattern. You got your brain connected because emotions is what is driving that. And then we can go through a whole series of reflexes to try to just narrow it down because like I'm sure you only have 1 or 2 stresses in your life, right?
Yeah.
There's just a couple things but there's probably a lot of things, and there's probably one thing that your brain has as the primo threat that it's
Okay.
always paying attention to, and you probably don't even know what it is because if
Okay.
we went through the series of questioning and found out what you reacted to, it'd probably be something that happened when you're 3 years old, when your best friend across the street stole your favorite toy, and like it's probably something very simple that was a big threat to your survival at the time and got
Okay.
and things get patterned in, right?
Yeah.
People are happy and all of a sudden they get in a car accident. So now every time they're happy, their body thinks, oh no, what's coming, right? They start to
Yeah,
brace,
yeah.
right? When we're little kids, the classic example, and we can sit down again if
Okay.
that's easier. Classic example is like as children, right? We start to draw on the crayon. Oh, look, they're drawing a picture. Aren't they cute? And then now you walk into a room and there's this big piece of paper. Well, if they were so happy with me drawing on that piece of paper, let's try this big piece of paper. But now you're getting smacked and yelled at. But they were so happy when I draw pictures. What happened, right? Because you're not conscious. You don't have a conscious layer to your
You
brain.
didn't use enough colors.
I know, right? You didn't get enough stuff on there, and so your unconscious brain is just drawing up these patterns because you can't really think, judge, or reason until you're like 7, 8 years old. So everything that happens to you
This
before is a pattern.
Fascinating to me. I could talk to you probably for the whole hour,
Yeah.
which I can't. I'm not allowed to.
I know.
But so we'll talk offline too. But I have to ask just because I'm curious. The first time you had to crack somebody's bones, was it scary?
It
Were you
was
like,
scary because again, I went to a chiropractor and my chiropractor was pretty low level. There wasn't a lot of cracking. He used the instruments, that's what I do now. I use instruments. There's other ways to move the bones and get the brain connected. And sometimes you just need that adjustment. And so, when I went to chiropractic college, I was actually kind of terrified because I was like, we don't need to crack bones to make people healthy. We could do all these other things. And now that I have learned the neurology, the science, how the bones actually work and how to do it in a way that is super comfortable, gentle, and effective. It's probably very different from the type of adjustments that people get. Not that the other chiropractors do bad adjustments. There's just different techniques. And the one that I've learned is very honoring to your body and works with your body so that you're always at ease. And it is still exciting to me every time I'm like, oh, we cracked, And it doesn't have to crack to be effective, guys. That's not what's actually doing it, but that's still the fun part sometimes.
Okay, interesting.
So, yeah.
Okay, I would love for you to share some information about how people can learn about you, contact you, if you're going to be out and about anywhere, all the good things.
Yeah, so our office is at 12th Street in Missouri. It's Breathe Chiropractic. It's breathechiro.com. We're on Instagram at breathchiropHX. We have a great new patient special. So if you call in and say, I saw you on the morning show, we'll honor that new patient special of $75 for your first visit to come in and do a full exam, have your first treatment, get a full experience, see our beautiful office, and then just we'll make a plan for you because, it could be emotions, it could be what you're eating. But again, this is the thing, right? Oh, it's because you eat too much. It's because you drink this thing. But you could stop doing that and nothing could change because there's still the emotion to it. Or vice versa. We could clear the
Yeah.
emotion, and if you're going to eat a candy, certain candy bar every day that your body doesn't like and not stop that, but it's more complicated than people would like you to think.
Okay.
And oh my gosh, I'm glad I'm not the only one that burns the biscuits. Woo! So
Okay. Well, on that note, we'll take a quick break and figure out what's going on with our fire alarm. But Dr. Carla, thank you so much for being here. It
Thank
was
you for having
fascinating.
me.
Yeah, and we're gonna take a quick break. Keep it here on Robot TV.